I educated a patient with gastroparesis who had it for 20+ years, and this was the first time that she was hearing anything about the diet side of things. And she was stunned. She had no idea that there was, a diet modification that she could include. We detect for malnutrition, and we do something called a nutrition-focused physical exam, NFPE for short. And that's when we look at places in the body where we see muscle and fat loss. And depending on the severity of the weight loss, we can document our findings and officially diagnose someone with malnutrition. So that kind of helps the doctors out with their medical plan. And we do help provide supplements, we encourage PO intake, and we can also do tube feeding. Growing up, I had always had a big interest in cooking, and my love language was cooking and preparing foods for my family. But as I got older, I discovered health and wellness and was interested in the exercise science field, kind of towards the medical field. So I went towards exercise science, and I took a couple classes, and that's when I discovered nutrition and that there's a whole entire field and major that I could transfer to. So that's when I decided to do nutrition. I had an undergrad in human nutrition. 2024 has a new requirement of having a master's degree to be a dietitian, so I got my master's. That was a 2-year degree, and it was all virtual, so I was able to work full-time. And after my master's, I had to do a 9-month-long internship, which is just a supervised practice. And I actually was able to do my internship here at Atrium, and they liked me enough to hire me full-time. Dietitians are required to do CEUs, which is continuing education units. So we have various education lectures, different journal clubs that we come together and just talk about recent research and just staying up to date with things like that. Yeah, I love inspiring and helping people with their nutrition. I feel like any sort of nutrition advice can help anyone, depending on whatever health condition that they have. Having good communication with people, just good people skills, and wanting to help people a lot. Patients have lots of different things going on at once, and it's kind of up to the dietitian to decide what the most priority is for their nutrition plan. In the clinical world, you can do certifications and specialties. So you can work at outpatient clinics with dialysis, you could be a renal dietitian, you can work with cancer patients as an oncology dietitian, GI, or nutrition support. Besides that, not in the clinical field, you can do public health, you can do food and management services, you can be a sports dietitian, lots of different things. Yeah, so I'd say reach out to any sort of volunteer experience in your local area for maybe meal assistance. You could do a local garden, or reach out to local dietitians just to see if you could job shadow. Nutrition goes a long way, especially with whatever health condition that you're going through and the prognosis. So I think educating people and just really getting them to understand how important it is very important.